Hello and welcome to another episode of the CIRS Group podcast. I'm JC,
And I'm Barbara.
and today we are talking about pain management. Pain was one of my top CIRS symptoms, and it was the thing I wanted to correct through CIRS treatment. So, it's something very near and dear to my heart. But today we wanted to discuss a little bit about pain management options that you can bring up with your provider. But before we jump in, just a reminder, we are not medical providers ourselves. We are patients. We are CIRS patients. We've read the CIRS textbook, but none of this is medical advice. And really, really, really with pain management especially, make sure you're advocating for yourself with your provider because it is so important to kind of get this under control even as you're going through the protocol.
Yeah, this is not a sign of weakness. This is not you asking for too much. If you are in pain and you are uncomfortable, um, and your illness is something you are constantly aware of just because of the pain that you are in, please do not feel bad or hesitate to talk to your doctor about what you can do to ease that side of it for yourself. And if you get some pushback from them, I would say maybe look at finding another doctor because every doctor should have some compassion, and especially a CIRS literate doctor should have the understanding that pain can be overwhelming to some patients, to the point where, the mood, anxiety, depression, all of that starts to come into play because the pain is so bad and no one deserves that. And so make sure that you are working with a doctor that understands that and is doing everything they can to help you bridge that gap.
Yeah, and with the Shoemaker protocol, we really talk about addressing the root cause, right? Getting out of exposure, taking the binders, eliminate the biotoxin that's causing this downstream pain issue for you. And that is still like number one big priority for everyone. But I think there is something to be said about these adjunct therapies to the protocol that make the protocol easier for you and make it a much I don't want to say enjoyable. That feels like the wrong word, less bad.
Tolerable?
Tolerable is a good one.
Yeah.
It makes it a much more tolerable process for you. I know in my own experience, because pain was my major symptom, before I knew I had CIRS, I would just lay awake in bed at night in pain, unable to sleep. And I would just pray to God, like, if I have to be in this much pain, please make it worth it. Like, please let me help other people through this pain and this suffering that I'm experiencing. And more than like, I don't know if I can say this because it was a symptom that I had, but more than any other CIRS symptom, this one scares me the most in terms of people living with, you know, pain that they just can't manage or regulate endlessly. It feels so hopeless to be in that situation. So, as someone who's on the other side of it, just to bring it back to a more hopeful state, as someone who's on the other side of it, I really think that by doing the Shoemaker protocol and also looking at how you can help manage your pain in the meantime, again, it's going to just be a much more tolerable experience for you.
Absolutely. Yeah. So let's get into some of the things you can ask your doctor about to see if it's right for you to incorporate into your overall treatment.
Yes, and we should say too that these different adjunct therapies we're going to be talking about, we're really pulling from the experience of our group members here. So we can talk about our experience with, well, I can talk about my experience with at least two of them, but some of these we don't have personal experience with. We're just more sharing the collective experience of our group members.
Yep.
So the first one is called LDN or low dose naltrexone. This is pretty well studied in areas outside of CIRS. So I know that with arthritis and arthritic conditions, it's often prescribed. And it's a loaded dose, meaning it's not going to be have immediate effect. You do have to take it for a period of time in order for it to start working. But a lot of people have reported uh, reduced pain levels, but also really great mood regulation on low dose naltrexone.
Another one that we see, and I have experience with this one, is well, I was gonna say weed, but no, let's call it CBD or cannabis. And I really did. And when I'm making jokes because, weed used to be an illegal thing and all of that, back in my day. But I really did use it for pain. I had a couple foot surgeries, and this was back in California when you could get a medical card. And I want to share this experience. I was obviously prescribed opioids because it was surgery. It was pretty major surgery to my feet. And as much as the opioids were great and for getting rid of the pain, the withdrawals were so bad. Like I remember cooking at my stove, probably eggs or something, and I felt so dizzy and something happened. I mean, I had CIRS, so there was that going on in the background. I had to just turn the heat off of on my stove and just fall straight to the ground and not fall, but I like dropped myself to just like recover. But that's how bad the heavy stuff can be. So that made me even more motivated to switch to weed. I mean, I was just smoking it. So that's how I had it. But it really did help. It was a wonderful pain reliever. I did try to find the highest CBD content within the THC CBD ratio. That's what I was recommended anyway, and that did seem to work. So it did help me manage my pain. Yes, I was high, but at least I wasn't going through those really terrible withdrawals with the stronger stuff. So I found that to be helpful even in surgery recovery. So I hope that's something that maybe you guys can use as you deal with your pain with CIRS.
So I know that Dr. Dorninger is a really big advocate for CBD, CBG products, so things that don't contain THC but still work on those opioid receptors to help with pain management. Personally, I tried CBD when I was kind of like at my worst, and I didn't really notice effects immediately. It wasn't until I really got on the Shoemaker protocol and then was still taking those CBD products that my pain levels reduced. So it's hard for me to say if it was the CBD or if it was just getting out of exposure and taking the binders that really had the most effect. But I know a lot of people in our group have said that CBD was kind of the thing that like carried them forward until they learned about CIRS and they could really start on the protocol. The next one is something called Kratom. It's spelled with a K. And in small doses, it's a stimulant, but in large doses, it works more like an opioid. So it does work on the opioid receptors again. And I've heard from some people that nothing else would work for them, but they tried Kratom and it did work. So that's just another thing you can talk to your provider about. Another thing you can look into is ketamine, which is something that is ketamine therapy is something that's used to help people process trauma. It's interesting because it works on glutamate receptors and can help rewire your brain. So we talk a lot about limbic retraining being a good adjunct to the CIRS protocol because it helps rewire those neural pathways that are kind of stuck in this chronic illness state. And ketamine makes those neural pathways more malleable. So I've heard a lot of people doing ketamine therapy for things like not even related to CIRS or chronic pain, but more like PTSD. And it can also help. And ketamine therapy, especially, is something you want to do with a provider. All of these things you want to do with a provider, but definitely work with a qualified provider for ketamine therapy. But I've heard amazing things about this one too. A couple of other suggestions. One is curcumin. I have an aunt and she's just so cool. She helped build the Voyager and she lived on a hippie commune in the 70s, and I could talk about her for an entire episode. But when I first got started getting sick, I reached out to her because she's dealt with chronic health issues a lot of her adult life, and she suggested to me curcumin. And curcumin, especially in high doses, is really good for pain management. But with a big caveat here, you don't want to take it if you are someone experiencing hypometabolism, meaning your metabolism isn't working correctly. You're not able to produce as much energy as you should be able to. And some signs of this would be like muscle soreness, fatigue from like you're out of breath from walking up a flight of stairs. Those can be signs of hypometabolism. And another thing is like if you have a wide anion gap, which like your provider would have to tell you that, you can't figure that out on your own. So definitely bring this up to your provider to see if it might be a good option for you. And then finally, MSM or methylsulfonylmethane. I did my best, guys. But it's a natural sulfur and it's used very common for people who are looking for more natural therapies for arthritic or joint pain. Another thing we've heard more recently in our group, and kind of the inspiration for this episode, was B1 therapy. So, taking high levels of B1 vitamins and make sure you're following a protocol if you're doing this. But it seems that, especially for people who are hypometabolic and you do have that buildup of lactic acid in your body, it can be helpful to take high levels of B1 to help clear it. So we'll leave a link down below to a protocol that a couple of our group members have done and really had like crazy success with down below.
So I think it's important to now also cover some often suggested medications that do carry some potentially bad or dangerous even side effects to them. First, we'll talk about is benzos. Now, these are anti-anxiety medications. Uh, Unfortunately, there seems to be a tie to people with CIRS having very, and I mean catastrophic reactions to taking benzos. And benzos, it's like Ativan or lorazepam or I've halcyon. Wow, Valium, Xanax. There's the more common ones. Um, I have taken benzos on an as needed basis. I've literally been prescribed them twice, and I have been very careful to never ask for a refill and truly only use it to counter something as serious as like a panic attack. I think in those cases, that's the most anyone should do. And even then, that can be, again, very dangerous, especially for people with CIRS. The reason that I keep harping on how dangerous this is that unfortunately, a lot of doctors, and hopefully they don't do this as much these days, but a lot of doctors are prescribing them like as daily medications to daily manage levels of anxiety. And the problem with that is your body becomes dependent on it. And it's in a way that's not like other, drug dependencies or addictions. It's something where physically your body needs it. It begins to need it. And getting off of them can be, I mean, some of the users have to actually split up this tiny little pill into fourths or eighths to slowly titrate down off of them. And if they don't do that, they experience horrific withdrawal symptoms. If anybody's familiar with Jordan Peterson, that is what nearly killed him, actually, was that process. So it is that serious. And that's why I'm sorry I'm harping on all the negatives there, but doctors can sometimes recommend them. And I think they're appropriate for people facing end of life, hospice. Like if you have anxiety about dying and you have a terminal illness, I think that's probably an appropriate time to use them because you probably won't need to deal with withdrawal, sadly. But in the case of CIRS, the idea is to heal and to treat it and to move past this. And so you don't want to mess that up for yourself by becoming dependent on something that is as dangerous as benzos are.
Another one is opioids, and I feel like we can just end a sentence. Like, how much do I need to say? Like, we as a society have become very reliant on opioids for post-surgery pain management, and it's really dangerous. It's highly addictive, and I know people in my own life who have had really negative effects of opioid addiction. And it's so unfair that providers are kind of, I think it's less so now, but commonly prescribing these. But again, it's not a long-term solution. While I do think it's important to manage your pain while you're in it, I do think it's important to do it responsibly so that, to your point, when you're on the other side of your surge journey, when you've gone through the protocol, you're not then also having to deal with, these side effects of the things you use to manage it. And so don't do opioids. Like,
It's hard because, with certain surgeries, the pain can be so great for really, so, and really for some SIRS people, the pain is so great that maybe opioids might be the only thing that hit that level. The problem is it, again, the reason that they get addictive is it feels so good. It's not just the absence of pain. You actually also feel euphoric. And for somebody who's dealing with chronic, now I'm selling opioids, just kidding. But I guess I want to explain, why they can be an attractive option. They just carry so many dangers along with them. Obviously, it should be a very short-term thing, and probably it's for a surgery or something where you're literally cut open physically and are healing that situation. And that's generally the only time doctors prescribe them these days, to my knowledge. Obviously, if you're rich and famous, you probably can get them more often. But yeah, and on top of everything, just to add insult to injury, opioids do constipate you. And as we all know, with CIRS, it is very important to be pooping every day. And so even if you do end up going down that route, it can stall the actual real root cause healing because you won't be able to eliminate, which means that you're not eliminating toxins, which is a very foundational step to the Shoemaker protocol. So, enough said about opioids. I think you guys get it.
And the last thing is NSAIDs, so non-steroidal anti-inflammatory drugs. And for me, when I first got very sick with SARS, it triggered an autoimmune condition that caused a lot of pain. And my rheumatologist recommended, uh, at first it was ibuprofen, and then later it was naproxen. And there's a couple of problems with NSAIDs. You shouldn't take them long term because it can damage your organs for one. But also it causes neuroinflammation. It's actually neurodegenerative if you take them long term. And then the third thing I'll say is that they stop inflammatory processes, which sounds good, if you have a chronic inflammation syndrome like we do with SIRS. But when you stop those processes, your body isn't able to regulate. It isn't able to like carry through the entire process and then move on. You're just kind of stuck in this like startup process of the inflammatory response. So it's almost compounding the effects of SIRS because regulation of your immune system. So especially if you're like getting into the protocol, that was at the when I started the CIRS protocol is when I started tapering back on the NSAIDs because I knew that it would be counterproductive for what I was trying to achieve, which was getting a re-regulated immune system.
Yeah. So once again, I think, if it's used short term as a tool, you know where you're going, you're being guided by a CIRS practitioner that understands the dangers of these medications and knows how much or how little to rely on them, um, then good. But I hope you guys have full informed consent now going forward as far as, whether or not you should start using any of these.
Should we go into your other pain relieving activities?
Yeah. So, so for those of you who are looking forward to an appointment with your doctor in the future to talk about any of the aforementioned potential therapies, other pain relieving activities that you can look into just on your own that are probably safe to do on your own, and just try them out and see how you feel. Um, there's a lot of heat going on. Heat tends to be a really good pain reliever. So that can come in the form of heating pads if you're okay with electronic devices in that way. Or if you want to do sauna time, or if maybe sauna is too intense for you, you can also do either a hot tub if you have access to that, or give yourself a hot bath. That can be a really nice, um, pleasant way of pain relief. And JC, I think you did those a lot.
I did. Yeah, I don't sweat. So hot baths was my go-to, and that would be my tip for anyone who doesn't tolerate the sauna well. You can get similar effects both in pain relief and detoxing by a hot bath versus a sauna.
Yeah, and on the flip side of all of this, I suppose I don't do this stuff, but I hear that things like cold plunges or cryotherapy or things that go on the cold side are also potentially good for pain relief as well. So that's another thing to play with if you're into that. I am not into being very cold, so I have not tried that. But most importantly, I think petting dogs, if you have one, cuddling your dog or cat or any fluffy creature, if you have a raccoon, you're very lucky and you can cuddle your raccoon. Or a ferret. Ferrets are adorable. Bunnies, anything soft and fluffy, guys. Go to a farm. Just kidding, that endotoxins. But but go. I think if you enjoy interacting with animals in any way, I think that they are just some of the best sources of joy and love.
Yeah, I know, like my poor dogs, when I'm upset, I go squish them and they're like, why are we responsible for your emotional regulation? But they totally are.
Yeah.
100%.
They are. They're the best. So definitely enjoy your pets if you have any. And if you don't, think about getting one because they're the best. If you can take walks, they are a wonderful motivation to get you outside into fresh air regularly. Yeah, I definitely have experienced a lot of healing through that. All right. Well, I hope that this episode is helpful to you guys, especially obviously for those of you dealing with intense pain. Our hearts are broken for you. We hope that you guys can get through this pain, support yourselves as well as you can. Make sure you're working with a CIRS literate doctor that understands and empathizes with you and supports you and is problem solving just as hard, if not harder, for you than you are for yourself on your pain. That is very important and you deserve that. So, of course, if you need any more information, resources, or support, visit us over at thesursgroup.com.
We'll see you there.